And so I'm going to dip right into chat a little bit as we lead into our next facilitator here. For any of you who know who are dealing with a health crisis, whether it be cancer or otherwise, you need a team. You need the doctors and people that are going to help you find your way, light the path, and inspire you, if anything. For me personally, I started with a shaman. I had a radiologist, I had an oncologist, I had a chiropractor, a yoga therapist, two different surgeons, two different Chinese doctors. I had this team, and so I'm really excited to introduce this next speaker, Dr. Gurdev Parmar of Fort Langley, BC. And I know so many of you, I can see B smiling. I know several of you have also had the pleasure of having him as a doctor as well. He's been a huge impact on my own version of what healing is and what wellness is. And those ideas around, believing in myself just as much as this team did. And so he really helped me and his entire team at his integrated health clinic, helped facilitate all of this for me. He is an integrative FABNO doctor. He specializes in oncology. He is a world-renowned author and speaker, and he specializes in topics like tumor microenvironment, as well as hyperthermia, which we're going to talk about in this next segment. So without further ado, we're going to dive right into Dr. Parmar and his recorded segment with me here. And just so you know, if you guys have any questions, we'll be receiving questions throughout this pre-recorded segment. We have a live chat with Dr. Parmar. He's going to pop on with us right after his pre-recorded segment. And so we'll be answering as many questions as we can in our time. And just don't worry if we don't get to your question. We get all these questions to the doctor. He'll answer those within a week, and we'll be able to email you those answers. But we'd love to see you. So when you guys type in those questions as they come up through this segment, we'd love to see you. You're welcome to speak to the doctor in person. And if you're not feeling it, you just leave a message and Frankie will make sure that we don't pull you up on a video screen there, or you can just leave your video out and ask a question yourself. But we'd love to see you. As well as that, Dr. Parmar is an author. He has written a book called The Textbook of Naturopathic Oncology, and we're giving 2 of those books away. So everybody who's participating today, we just put your name in a raffle and we pull a couple names out, and we'll be hitting you up via DM or private message and sending you one of his books. And so, yeah, without further ado, we're going to dive in here to this conversation with Dr. Parmar, and I hope you're inspired.
Hi, my name is Gurdev Parmar. I'm a naturopathic oncologist in Vancouver, British Columbia, and I have been given the honor and privilege of speaking to you all today by Megan Pischke, who I've known now for a number of years. So I had a busy day. I played tennis for 3.5 hours. I took you guys to my tennis club and then to a match that I was playing with my doubles partner, mixed doubles partner. And so a little glimpse into my personal life. So again, I'm a naturopathic oncologist in Vancouver, British Columbia, Canada. I have had the honor and privilege of working with now thousands, close to 15,000 people living with cancer in my practice, several thousand women with breast cancer. The word doctor means teacher. My job's really to teach my patients what they need to know so they're able to make informed decisions. And I believe that the only way that they can make informed decisions is if they know what all their options are. Not just conventional options, which I do review with every patient at every visit, but also what naturopathic or integrative treatment options there are. And I help my patients at every stage of the cancer trajectory, from primary prevention to screening to diagnostic workup to active therapy to secondary prevention and secondary prevention screening and survivorship. And so through that whole trajectory, I work with people, and there's a lot to that that we have to share as far as information is concerned. And I do believe, based on our own research from 2010 to 2018, that our patients that make use of our integrative approach not only have a better quality of life, um, but they also have an improvement to overall survival. And so what we know is that for the 10 most commonly treated solid tumor entities at our clinic from 2010 to 2018, there was a statistically significant difference in survival time between the patients that integrated our treatments with their standard of care versus those that did standard of care alone. And this has been published now by Cambridge scholars, and I sincerely hope that I'm able to follow up that retrospective, non-controlled, longitudinal observational study with a prospective trial, which requires a great deal of funding and IRB support, which I have yet to gain. But I do believe that with more effort, more sustained effort, this will eventually come to fruition. And there will be evidence that shows that the integration of naturopathic oncology with standard of care not only improves quality of life, it also does improve survival time. And so I hope to prove this over time. And I did mention this earlier, but I'll say it again now in this format. Um, I am the lead author and editor-in-chief of the textbook of naturopathic oncology, which can be found at https textbookofnaturopathiconcology.com. And this is the main resource used by people in my profession that treat cancer patients. And I'm happy to announce that start this week, actually, pearls.info, pearlz.info, will be launched, which will be an ebook library, a medical ebook library, a great resource for people living with cancer, where you can find information on your specific type of cancer or your specific symptoms, or information that is more specific to you, and gather that information at pearls.info and share it with your treating physicians, naturopathic oncologist, medical oncologist, radiation oncologist, surgical oncologist, whoever is your team. Please share this information with them, and so it can be safely incorporated into your treatment plans. Again, I thank Megan for the opportunity to speak to all of you, and look forward to getting this lecture on the road. Thanks. Bye.
Hi, Dr. Parmar.
Hi,
Thank you so
Megan.
much for being a part of this thing we got going on.
Thanks so much for the invite.
Yeah, and so I mean, I've fortunately been able to experience your dedication and your passion and your interest and your wisdom in cancer, and so thank you. And you were a game changer for me when I came to you, first diagnosed, kind of just finding my way out there, and you were, you know, one of those people that really made me feel hopeful, so thank you for that.
Thanks so much.
And I'm just curious, what has led you and your wife, Dr. Karen Parmar, to build this integrative health clinic here in British Columbia?
Well, I met my beautiful wife Karen in medical school, and we had she's from Nova Scotia. I don't know if you know that. I'm from the West Coast. I'm from B.C.
Oh.
We met in Toronto, center of the universe, and When we were deciding where we wanted to set up practice, we decided to set up our practice here in BC. And we've always been very interested in integration. So we're both MDs, as you know, we're both naturopathic physicians. And we've had this philosophy that we are a part of a team. And you know, the whole system needs a little bit more of this, that there needs to be more integration amongst conventional medicine, you know, surgery, chemotherapy, radiotherapy, whatever the case may be in the world of cancer, and then all of the naturopathic treatments, and more of a philosophy. And I think, you know, right from the very beginning, we've had a very unique style of naturopathic medicine where, you know, if there's a spectrum of naturopathic medicine, we were, you know, on the more conventional end of the spectrum. We use just conventional diagnostics, and everything that we talk about is evidence-based and evidence-guided. And
you know, you hear a lot of that in integrative. I had a lot of people question my alternative methods where I'm like, but wait a minute, I'm not, you know, choosing not to do chemo, not to do radiation. I'm simply integrating other ideas into all of this to maximize it, right? So what would you say to the people that call naturopathic medicine pseudoscience?
Oh, I love conversations with those people. Well, you know, I would say that there are things that are encompassed within naturopathic medicine that don't have a great deal of evidence. And, you know, really the evidence is historical. You know, humans have used it for thousands of years, and there's probably good reasons. You know, there's billions of plants on Earth, and we only use several hundred or thousands of them medicinally, and humans have figured that out over millennia. And so you know, perhaps that's pseudoscience. But if anybody, for example, looks at my textbook, there's 2,800 references in my textbook. So I'd love to have a discussion with anybody that thinks that what we do is pseudoscience in this field. I love discussions with people that think that.
And when I first met you, I mean, I guess I was like, so how many people have you seen with cancer? Remember that? And you kind of chuckled and you're like, well, over 10,000 or something. I don't know what you had said, but a lot of people with cancer. And so in that you wrote a book, right? Because what you're saying is science. When you're seeing somebody over and over again, and you're seeing the tried and true, and you're seeing how the IVs are working, or you're seeing, you know, how certain things are working integratively, right? So I definitely want to dive into some questions. First of all, what's the difference between you and a quote unquote regular oncologist? Because you said that your methods of testing are very similar. So what would the difference, would you say?
Okay, well, you know, in the world of a conventional oncology, you know, there's medical oncologists and radiation oncologists and clinical oncologists and surgical oncologists, and they're all in the world of oncology, right? And all of those people go to medical school to become a medical doctor. So I'm a naturopathic doctor. We also go to school for 8 years to do what we do, and then do additional training afterwards. The difference is philosophy. In addition to learning conventional medicine, which we must know because of all of our patients are making use of it, we also learn nutrition and lifestyle interventions, botanical medicine, traditional Chinese medicine and acupuncture, how to adjust the spine and soft tissues of the body. Like, you know, we're like the gatekeepers of all things, you know, not conventional. And you know, I think we're in a very unique and privileged position. A person can come to see somebody like us, and then we can kind of direct them to where we think they would best be helped, if it's not us ourselves. So, you know, there's this ND, MD difference. And then to become a naturopathic oncologist, takes a residency in this, where you have to do rotations in all of those different fields. Like you have to do rotations in surgery and radiation and chemo and all these things. So you learn all that, and it's a part of your training. And then you have to write exams and
so you're legit. You're legit. That's what. Yeah.
And we have quite an amazing community
Group.
in Canada
Yeah.
and the United States. Yeah, a pretty
Mm-hmm.
extraordinary group of people.
And so what I also loved about the integrative vibe is that you guys really allowed me to make choices, but also got to know me as a patient versus you are patient A and you're this age and you're this height and weight and et cetera, et cetera. You guys really took the time to get to know me. And that's really what that integrative medicine is all about, right? Because we're all snowflakes. We can't just show up as patient A or B or C. We're all so individual. And I feel like that's really the edge that integrative medicine allowed me to have, was to be a part of that alchemy. You know, how do I meet that medicine halfway and help it work better, right?
I love
So yeah, we're
You
all
know the
alchemists, right?
You know the word doctor means teacher, right? Docere, and doctor as
Ah.
teacher is one of our 7 fundamental goals as ND,
Mm-hmm.
is to teach our patients what they need to know so they're able to make informed decisions. And
Yeah.
it's tough to make informed decisions if you don't have the information.
Yeah.
So yeah, thank you for saying that. That's really important to me. It's like the flag I bear. So I'm glad
Yeah.
to hear that.
Right on. So then let's dive in a little bit into genetic testing. I wasn't offered genetic testing until the end of my treatment or whatever. And I'm assuming that's just because there wasn't any family history, right? And generally that's why you do genetic testing, is family history or even the type of cancer, right? So it depends on the type of cancer. And so I guess what my question was, and maybe this is totally out there, but isn't there a type of testing that you can do to see the efficacy of chemo, let's say, to avoid somebody doing chemo? Maybe they don't need chemo. I don't know. Like, is that?
There is actually. So let's talk about breast cancer specifically. There's a test called the Oncotype DX test.
Okay.
And this test is usually used for women that are very early stage. So maybe no lymph nodes or a lymph node involved. It's the criteria here in BC change, as you know. So I'm not quite certain what the criteria are today, but the Oncotype DX test, essentially, if a woman is early stage and the doctors and the patient want to know, do I need to do chemo? You know, because I've done surgery and perhaps I did radiotherapy or whatever. Now, do I need to do the chemotherapy? So there is a test called the Oncotype DX test that looks at a number of genes and tells you what probability is that the chemotherapy is needed or not. And, you know, I'll say something else to you about why you weren't offered genetic testing. You know, this is something that is exploding right now. And you know, in the last 5 years, let's say, it's become much more commonplace to get testing. And now there's so many testing platforms available. You can just order tests online and get a whole bunch of genes tested and figure out what your risk profile looks like for certain things. This science is, you know, next generation sequencing and microarrays and all these different types of genetic testing are now available. And I would say that we're all learning about the value of it.
Interesting. So then back to kind of what you just mentioned, the breast cancer screening guidelines, right? So when somebody comes into you, I think I found a lump in my breast, right? And you're part of a team, right? There's oncologists, there's radiologists, there's that team of doctors. So in your guidelines, how are you going to guide somebody to when they come in? What are those guidelines for a naturopathic direction?
Okay, well, I mean, as far as like guidelines are concerned, what is being recommended as large, you know, guidelines, the Canadian guidelines, the US guidelines, you know, whatever country's guidelines, there's not a lot being recommended for screening, which you should know is a bone of contention for me, because ultimately my belief is that early detection is the key. And my sincerest hope is that instead of all of the money that's raised for cancer research going into cancer treatments and chemicals predominantly, that we should be spending a good 25 to 50% of the money that's raised for cancer research in screening and early
prevention.
and prevention. And unfortunately, this hasn't happened my entire career, and I do hope that this does happen at some point. But let me answer your question. So a woman comes to see me, she says, I found a lump. And now what? So a physical examination, of course, a breast examination, check out the nodes around the axillary area, whatever. Send them for imaging, and you know, this is a long discussion with everybody every single time. You know, mammography, ultrasound, MRI, thermography, you know, all these different technologies that are out there for determining what that breast mass is or isn't. Then needs to you then need to go into that algorithm. And then once we get the imaging back, it gives us an idea of what's next. So is a biopsy necessary? Is it not? If the biopsy is positive, what happens? If the biopsy is negative, what happens? Is it DCIS? Is it carcinoma? I mean, so great question, Megan. Just you start at one place, and then there's a whole bunch of possibilities.
It's different for everybody. I get it. So
different for everybody.
Like, so then rewinding just a tiny bit, when you talked about the preventative part, right? Like, I have a daughter. I don't have a history of breast cancer in my family, but thankfully I've been involved with boarding for breast cancer in my younger years enough to know that it can happen at any age, right? And just, you know, knowing your body, doing your self-breast exams, being regular with that, right? And then all of the other preventative things that come into play, the nutrition, the exercise. You know, I've talked to a lot of women, and some of them are like, you know, what is obese? You know, obesity runs in my family. We're just kind of chubby people. I've heard people say that. And like, why is it that, and I exercise and I eat good, but I'm just a chubby person. And why is, you know, there's a lot of, why did I get breast cancer? I'm not obese, right? Like, technically, if somebody's exercising and eating well, shouldn't that just kind of delete them from the puzzle?
That would be fabulous.
I know.
When we talk about obesity in the trials, we're talking about a BMI of greater than 30, a body mass index of greater than 30. And then how do you determine body mass index? Well, that's another conversation.
Yeah.
But let's say body mass index greater than 30 is the risk factor. I'll just share with you one quick thing. So there's a nice large meta-analysis of 70 clinical trials of 80,000 women with early stage premenopausal estrogen receptor positive breast cancer. Obesity with where it's graded as a BMI of greater than 30 increased the risk of death by breast cancer. And the difference was over a 10-year period, at 21.5% a risk in the obese population of a BMI greater than 30 versus a 16.6 in the non-obese group. So it doesn't sound like a great number, but you know, every 5% counts. So, and that was presented at ASCO in 2014. And, you know, you just look at all of the data, obesity is now the second leading preventable cause of cancer. And we're talking about basically all cancers now, next to smoke.
Wow.
Yeah.
Wow. Okay. So we can take control to some degrees, whether our thyroid is off, whether we don't have access to the super organic whole foods scene, you know, we can still educate ourselves.
Absolutely.
And
you know
on the food.
I think there's always a way, huh? There's always a way.
Yeah, it's true that.
You know, when I have people come in, they're like, you know, my family's just like this, and this is just how I am, and whatever. I'll say, I hear you. I get it. But nonetheless, this is what we're gonna do.
Yeah, let's try, right?
Yeah.
And
nonetheless,
some people
this is what we're gonna do.
Yeah, and some people just need the nudge, you know, and yeah, okay. So I'm going to back it up just a little bit because I wanted to know more about the thermal imaging. And that's something that it was actually the very first thing that I did, and now use as not a diagnostic, what am I saying? I use it as a yearly tool to see what sort of changes are in my breasts, right? So is that something that you offer in a stage of like, okay, I'm in my 40s now, I'm going to start doing regular mammograms. Is this something else that I can add, right? The thermal imaging.
Correct. So it is not a standalone. Let me be very clear about that.
Yeah.
This is a temperature. So I call it digital infrared thermal imaging, or DITI. And so essentially what it's looking for, when layered on top of a mammogram and or ultrasound or MRI. So as you know, mammogram, ultrasound, MRI are imaging technologies that look under the skin and are looking at the tissue under the skin. And we must have that kind of technology on board to be able to see what's inside. But let's say a woman finds on a mammogram, for example, a lump, and she wants to take the next step to determine whether this is something that she should be concerned about or not. So a thermography, a DITI, a digital infrared thermal imaging, will tell us if that is a hot spot or a cold spot, essentially, because thermal imaging is looking for temperature differences. So essentially, it's looking for early angiogenesis, like blood vessel formation.
And that's going to be a hot spot, right?
That's going to be a hot spot.
That's going to be warm.
Correct. Yeah. And if it's a cyst, for example, just an isolated cyst, it's going to look like a cold spot. So when used alongside a structural imaging, I have found in my 21-year career that this can be a useful tool to help answer one question beyond the structural question.
Okay.
And so whether it's a woman in primary prevention, she's never had breast cancer, she's now doing self-breast examinations, and she's going in for annuals, she's doing a mammogram or ultrasound, whatever the case may be in her case. And then, at the same time as the other type of imaging, we would layer on that thermography.
Okay. So I want to go one layer deeper with something that I really felt was kind of my secret weapon. I don't know, who knows, right? The perfect storm of cancer, and then there's the perfect storm of treatment, right. Especially if you're doing a whole lot of it. Yeah. So the hyperthermia, and it's not called hyperthermia anymore, or is it?
It is. It is called hyperthermia.
Okay.
So hyperthermia, hyperthermia is another umbrella term. There's a bunch of different types of treatments that fall under the umbrella of hyperthermia. What you have become familiar with is loco-regional hyperthermia, where you need a local part or a region of the body. There's also fever range whole body hyperthermia, which is where you're initiating a fever to stimulate the immune system. And then there's, ablative hyperthermia, like where you go in and like surgically with an interventional radiologist would do this using. Oh, wow. Yeah, radio frequency ablation. So all of these are hyperthermic or hot treatments, hot techniques for treatment. There's also the opposite, the cold, right? There's cryotherapy, you can freeze stuff. And this is, ancient, you look at Ayurveda and traditional Chinese medicine, and for thousands of years, hot and cold is important.
And Wim Hof and Finnish and Norwegian people. And
correct. It's true.
And so then why is hyperthermia so hard to find? Because I feel like I've struggled to find that, or ask people to look into it, and they're not finding it in very many places in North America. So
well, it's a great question. You should know that FDA has not approved the hyperthermia device, for example, that Health Canada has approved, the treatment that you're familiar with. So it's tough to find in the United States. There are some hyperthermia centers in the United States, but they're hospital settings. And as far as I know, the places that I'm aware of, it's used in conjunction with radiation. So of course, for the patients that are open, willing, and interested in doing hyperthermia with radiation, they have an option. And for those that aren't, they're typically having to travel outside of the United States to get it. So subsequently, I see a lot of US patients in my clinic here in Fort Langley.
Yeah.
And now in Canada, I'll tell you, I was the one that brought hyperthermia to Canada. It took 2.5 years and all my hair. And
Yeah,
that was
I
back in
remember. Yeah.
2009, 2010. And now there are, I believe, 10 centers across Canada, all naturopathic clinics that are offering local regional hyperthermia. So from BC to Ontario.
That's great. That's good news. And then what about the all over, the fever treatment?
So the fever treatment is a little bit more tricky. There's only 3 places that I'm aware of that offer that. And it's, all about approvals, Megan.
Yeah.
It's about approvals. So getting approvals for devices is not an easy thing. You have to, share all of the evidence, show the safety, show the benefit, and then an approval can happen.
Okay.
In the United States, that approval process is quite difficult, and my understanding is very expensive. I don't know. I guess just no company that's large enough or has the type of funding that's needed has taken it upon themselves to do that.
Yeah, that fever treatment. I know I've talked to several women who actually received it in Europe, and then again at your clinic at some point, or in Toronto. And I wouldn't say they love it, nor did I, but it was something, especially living in such a cold, damp climate as British Columbia, I felt it was helpful.
Yeah.
I'm going to jump into like nutrition a little bit.
Sure.
We have a really great chef that'll be coming on with us, but I feel like from a medical perspective, right? Like food is medicine, pretty much.
Yes.
And it's all about going to food school. When you get cancer at Cancer University, you go to food school.
Right.
To like really try to dial in. And again, we're all snowflakes. What's going to work? And there's so many diets. Everyone's talking about do keto. Keto's the way to go when you have cancer. Or some people are like, do the blood type, but then, just don't eat sugar. And there's so much information. So I guess it would be helpful from a medical perspective, right, to have that direction, right? Like where do you find your way in the food part? Because there are, whole foods, plant-based, no fish because there's too much mercury. Oh, wait a minute. You need a little bit of fish. Only free range chickens. I don't know. Or do you even eat meat? Like it's a really complicated subject. So can you narrow a little answer down for me?
I can. The American Institute for Research in Cancer, the American Cancer Society has what I would consider to be very good general guidelines. And then you should know in my book, I actually, with a team of people, dissected all the different types of diets that you're talking about. Yep. Keto, alkaline,
paleo,
stuff,
paleo,
right? Paleo, right. So how do you decide? Well, I'm quite moderate in my recommendations for diet, as you know.
Yeah.
I think that you should be taking the best of all of these of all these diets and coming up with something that's reasonable. You should know that basically where I have ended up after looking at everything that I can see on diet is a low glycemic index, a low glycemic load, vegetarian dominant, whole foods diet, Mediterranean-like, right? So I think what everybody will agree with is this: humans have been on Earth for a while, and we've been eating as long as we've been here. And probably the best thing to do is eat as closely as possible to the diet that humans have always eaten. And, all the stuff in boxes and cans and the stuff that can stay in your pantry for decades and bugs don't eat it. Probably we shouldn't eat it either.
Yeah.
And the less refinement, the better. The closer it is to how it's picked or grown or whatever,
Yeah.
harvested, the better. Um, and so there's a good general
Yeah.
sort of idea,
Okay.
right?
No, that's
And
good.
right. And then the other thing is, for all of human history, it's not like we could just reach into our refrigerator or pantry and eat whatever we wanted whenever we wanted it.
Mhm.
Where you lived, your diet changed because of what you could get during the season, right?
Yeah.
And that's a good idea. Change it up. Don't eat the same thing every day, and allow yourself to feel hungry, because that's a good thing to feel hungry. It
Mhm.
initiates all sorts of things in your body when you feel hungry. And for people that are afraid of feeling hungry, I encourage them to embrace the feeling of hunger.
So
And
that's fasting, right? That's the overnight fasting, and that's something I know you talk about in your book, and I know that you guided me a little bit on. So the fasting just means to allow your body. It's like a metabolism thing, right? You're allowing your body to get those juices flowing and whatnot. And that overnight fasting, is that something you do every day? I don't know. I
every day.
kind of yeah, I kind of
So,
do it every day.
we
So
call it fasting now, Megan, and before it used to just be called life, right? I mean, we call it fasting now because we can just do whatever we want whenever we want with food. But yeah, it used to be life.
yeah.
Fasting was an essential part of our lives. You think about it, humans used to have to fatten up and put on like 20 to 30 pounds to overwinter, right?
For the
Not have like
winter, yeah.
bears and such. And we that's what all the berries and the fruits are all about, is like all that high sugar stuff is pack it on, get ready for winter. Well, we don't need to do that anymore. So intermittent fasting, I think, is a really smart idea. It's not just
Hmm.
about it's making your insulin receptors more, getting them sensitized again, not having them all plugged up all the time and having them free. So when you do eat, you're more efficient with how your body's utilizing the fuel.
Okay.
Uh, there's a million reasons why I think intermittent fasting is a great idea. If anybody's interested, I'll introduce you to my Oprah Winfrey. His name's Dr. Peter Attia, Attia, and he's got a podcast called The Drive. And
Nice.
he probably has like 30 or 40 or 50 podcasts just on fasting, fasting
Wow.
mimicking diets, all of that stuff. So if anybody's interested in getting educated on that, I'd recommend him.
Well, just that's great. Perfect. And just like on like a little wrap up with food, I feel like nowadays everyone's so busy. They have so much going on and da 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 da. Like really taking time to know what you need, or meal planning one day a week. I mean, it's kind of a job. And if you think about it,
It
we
is a
eat
job.
every single day. We're going to need to eat. So we might as well make it interesting, right?
Exactly.
And that's the great thing, is there are so many chefs and podcasts and Instagram pages with inspo, and there's a lot of great stuff out there. So kind of on the topic of food, I wanted to bring up supplements a little bit, just because I know that that's a big part of your recommendations and adding supplements. Uh, I remember as a hormonally driven cancer, you were like, well, I don't know about flax. There isn't enough studies around that, or soy, or I had all these questions. What about, can I do maca in my smoothies? And you're like, well, I don't know. Right. So there are things that you need to be aware of.
Absolutely. Just because it's natural doesn't mean it's safe.
Yeah. Gotcha.
And the other thing is supplements. I think it's an important thing to state that supplement, by definition, means supplementary to your diet.
Yeah. You can't just eat a vitamin and expect it to take over, right?
Correct. This is in addition to a good, healthy, solid diet, which is the foundation, and food is medicine. Let food be your medicine.
Yeah.
And then supplementing with things that you need. I mean, green tea, for example, this is the popular supplement out there. One capsule of 80% polyphenols, which is greater than 50% of EGCG, which is the stuff in the green tea that you want, EGCG, the catechins, is like 2 cups of green tea. So studies show that you need to consume like 8 to 12 cups of green tea to lower incidence of cancer. And most people are like, I just can't do that. I mean,
Yeah.
you can take this in a capsule form to supplement what you're taking in. Same with things like curcumin, which comes from
turmeric.
And how much turmeric can a person eat when this tiny little ingredient in it is what you want? So we've learned a lot through science. What is the active ingredient, right?
Yeah. Okay.
Yeah. So there's a lot to know about supplements, and this is another reason why I think a naturopathic oncologist is such a critical part of everybody's team. Everybody needs one. Somebody's been diagnosed with cancer, and they're at all interested in what can I do for myself.
Yeah.
So the doctors are giving me my treatments, but what can I do for myself? What power do I have? What can I do?
And that's a great point, because I don't think, at least in my era, and I know in my parents' era, you're not really taught to make informed decisions for yourself, really. You're kind of like, well, I don't feel well, and you hand yourself over to a doctor. And I'm not saying that that's a bad thing, because so many people do it. It's just we're not taught that we actually do have the power, especially when you do have cancer. I mean, I kind of felt at some point intuition is out the window. Just whatever you say, I'm going to do. And then you like calm down a little bit and you're like, okay, I'm going to read about this. I'm going to see what feels right to me. But you're the one, integrative oncology. And I know there's a lot of great other oncologists and MDs out there who are now starting to guide and work with a team versus just themselves, right? Because the science is there, that food and supplements and support and really that fear-based medical treatment, right? And that empowering space.
There are a lot of medical doctors that are integrative.
Yeah.
And I have the pleasure of working with many of them on a daily basis. And there's functional medicine doctors, MDs that are called functional medicine doctors, and they do integrative medicine. There are a ton of incredible oncologists out there that are integratively bent, and they practice an integrative style of medicine. And I don't think it really matters whether you're an ND, an MD, a DTC, whatever stripe it is, we're all doing the exact same thing. We're all trying to help people living with cancer live the best lives possible, live as long as possible and as well as possible. We're all doing the same thing. So, yeah.
I love it. That's good. I kind of want to just jump into your book really quick, but before I jump into your book, can you give me any insight on microdosing, psilocybin? Just give me your thoughts on that. What are you doing with that?
So I haven't used it in practice yet. I think, well, I'm a fan. I obviously prescribe lots of Coriolis versicolor, turkey tail mushroom, and reishi, and cordyceps, and agaricus, and lion's mane, and all of these mushrooms that have phenomenal research. And I don't think it's a mistake that humans have forever used medicines like psilocybin. From the little literature I have read on microdosing, what I've seen is that the people living with cancer, for example, even end-stage patients, after one treatment with psilocybin under supervision, have a completely different relationship with their illness, have a completely different relationship with life and death, have a completely different relationship with their connection to everything and everybody around them. Mm-hmm. And I think it's something that I personally want to try.
Right on. I'm down with that. Yeah.
So I think before I ever recommend it to a patient, I'll need to go on my own little journey with it. And I don't know if you remember this about me, Megan. I've basically tried everything I prescribe to my patients on myself.
I do remember that. I love it because I was like, hey, have you tried that mushroom coffee? And you're like, I'm going to get some. And then you're like, I love it.
You got it for me. and I still love that stuff.
Yeah. Yeah, I agree. Okay, so we didn't get to dive into your book too much, with exception to, I did let people know before we hopped on here that we're going to be raffling off a few of your books out to our audience. So, which would be really great. But if people want to find your book and find out more about it, where can they go? Is it on Amazon or?
It can be found at https:/textbookofnaturopathiconcology.com.
We'll put it on the screen for you. We'll put it on the screen. It'll live on the screen here.
All right, cool. And then, this is very important for me, Megan. So the textbook, as you know, is really meant for a broad general knowledge of naturopathic oncology. Some people might think more for doctors and practitioners than patients. Mm-hmm. So I'm very proud to tell you that the textbook has now just been made accessible to the public through pearls.info, PEARLZ.info. So www.pearls.info. And what this is, the book has been broken down into accessible little bits. So if a person doesn't want to know about 24 cancers, they just want to know about breast, they can buy the breast thing from the book.
Amazing.
So I'm really excited about that. It's just being launched right now. But it's live now and it's going. So Pearls.
Congrats.
Yeah, thanks.
Because I know that's a big career thing, especially for a doctor. And I know you've got so much wisdom, and I'm just so grateful that you're sharing it with this audience and that I'm here today. Thanks to you. You were part of my team, and I really appreciate that. And everything that you had to share today, I feel like I could just keep expanding on. So I just encourage everybody who's here with us today to keep learning about themselves and learning about the world of health and wellness and how to take care of themselves. So thanks for being a part of that today, Dr. Parmar. Yeah. I hope everybody got a little bit of something out of that conversation with Dr. Parmar. We're going to dive right into the Q&A, and I'm going to try to pull up Veronique for Dr. Parmar. I see you, Dr. Parmar. I see you there. Thanks for joining us live. It's awesome.
Can you hear me?
Hi. Yeah, I can hear you.
It's great. It's a breast cancer thing. Wellness after cancer.
Are you like part of it?
Yeah. So we're gonna, hey Benny, can you mute yourself real quick? Thank you. I'm gonna try to pull up Veronique. I know that she just wants to ask here a question to you. I don't know if her service is good. Veronique, are you out there? She had bad service. So I'm just going to go ahead and ask this question for her, Dr. Parmar. She says, can I have my 15-year-old daughter tested? And I'm assuming she's meaning BRCA tested.
Well, I think that depends on where you are. The one thing that I'll say is if anybody's going to have children tested for genes, they're working with somebody that can walk them through what the results mean. Genetic testing, genetic counseling is a big deal. I mean, you're telling somebody, you're likely to experience something like this in your life. I would say to Veronique that find yourself a good healthcare provider, whoever that might be, wherever you are, Veronique. I don't know where you are. And make sure that you have that kind of testing done on your daughter, knowing that you're going to be able to review the results of it, understand the results of it, what the implications are before you undertake that. That's the best advice that I can give for Veronique. That's a good question. Megan, I have a question for you. I'd like to come to where you are. How do I do that?
I'm going to teleport you. Hold still.
Okay, maybe on psilocybin. Are we heading there?
Don't we all want to be in the jungle right now? That looks amazing. Dr. Parmar, such a pleasure to meet you. First, I just want to say thank you so much for the incredible work that you are doing and dedicating your life to. Clearly, it's making a huge impact, and we are just filled with so much gratitude. So thank you. We have a question from Jenny. Jenny, are you available to pop on the screen and talk to Dr. Parmar? We'll see.
Yeah, I'm here. It's a little windy. Hopefully you can hear me okay.
We can hear you.
We can hear you.
Hey, yes. So my question is, you kind of answered it in the notes section, but I was wondering, how can someone control their estrogen levels naturally to the best of your ability without tamoxifen? Say you have to go off tamoxifen due to just the side effects of it.
Yes. It's a very
That's
good
my problem
question.
right now.
Actually, when I first gave Megan and her team my slides, there were actually a couple of slides on this subject. So I don't know if you guys are able to share those with the attendees, but I think that would be really helpful. So first, let me say, as I said in the notes, that what I would do with you is there's this software called Predict. If you guys don't know Predict, you should know Predict. It's from Cambridge University in the UK, looking at millions of women and what their exact diagnosis was. So age at diagnosis, size of the primary, lymph nodes positive, negative, ER status, PR status, HER2 status, Ki67 status, all this stuff. And then it predicts what is the actual statistical benefit of chemotherapy or hormone therapy in your particular case. So when I run this software with a lot of my patients, I think it makes them feel much more comfortable with the idea that they are having horrible side effects to, let's say, tamoxifen. They're unable to continue it because it's ruining their life. And when they see the Predict software tell them that, look, if you do take tamoxifen, it lowers your risk of recurrence by 1% or 2% or whatever the number might be for that particular patient, it really helps them feel comfortable with their decision not to use tamoxifen, let's say. And then so that's the first thing I would do, is actually find out what is your benefit from this. And then how do you lower estrogen levels naturally? There's lots of natural therapies. I think somebody's putting something up there, which looks great. But there are lots of natural therapies that are known to reduce circulating estrogen levels. And some that even act like tamoxifen, like tamoxifen's a SERM, a selective estrogen receptor modulator. There's melatonin in high dosages is also has SERM-like effects, has aromatase inhibition effects. So there are other things that we can do to help lower estrogen, reduce the risk of recurrence using these natural therapies. But let it be said, there is nothing natural that has the evidence to say you could do this instead of tamoxifen and it'll work as well or better or worse. Like we just don't even know. So that must be known by whoever is deciding to go off of tamoxifen and to use something instead, that they are swimming in a little bit of a world of unknown.
Right. Okay, thank you.
Hi, I'm going to pull up Heather. Hi, Heather. Saw you in Grand Targhee in January. Are you out there? Do you want to hop on and ask Dr. Parmar those important questions that you shared in the chat?
Thank you so much for this wealth of information. It's amazing. I think, in my own experience with treatment and so many of my friends throughout their process, their MDs kind of just give you a blank look often when you try to talk about integrative medicine and especially accessing that. And I know, Megan, you really talked about this a bit, that we're not really taught to have our own power and to be empowered and trust our intuition. But any other insight you can share about, in America specifically, how can we encourage a shift so that it's more part of our mainstream culture, and maybe any thoughts about equity in access to integrative medicine?
Wow, Heather. Okay, so I think I should address the first question because it seems a little bit easier, because the second question, as far as equity in healthcare, that I think I need to know exactly what you mean by that first. So this is an ongoing daily conversation that I have with all of my patients, truthfully. You are correct. I mean, here in British Columbia, I can speak for my own world. The vast majority of medical oncologists or radiation oncologists recommend to their patients that they not make use of any integrative treatments during that treatment. And nonetheless, people do follow their intuition. They listen to their higher selves. They listen to their family members or loved ones who are encouraging them to do whatever they can, in addition to their standard of care, to get the best outcomes possible, to help manage the side effects, etc. And as some of the people on this call know, who are patients of mine, who have worked with me, I send consult letters out to the rest of the oncology team for every one of my patients. And I don't do that looking for approval from anybody else, because I don't feel like my patients and I need approval from anybody else. It's actually to educate them. And I think each and every one of us can only control our own little circles in our lives, right? Not just in medicine, but just in life generally. And I think each and every one of us needs to advocate for our collective desire to see a shift in the healthcare system where there is more emphasis on what a human being, what an individual can do for themselves. It's not like we're lacking in evidence. The amount of research on nutrition and lifestyle and exercise and herbs and vitamins and minerals and amino acids, I mean, I can go on. There is a ton of research out there that helps guide us. And a lot of that research is done in conjunction with standard of care. So there is safety data. And I think it's just one step at a time. I can tell you, Heather, that this topic that you've just asked about, how do we make this shift happen, is basically like a life goal, a professional goal, not just of myself, but thousands of doctors out there. And I do see it's happening. 21 years later, the conversations that medical oncologists who previously were very negative about integration are having with our common patients, they're changing. So I think it is happening. But it's going to need to happen from a grassroots. It's not going to come from the top down. That's for sure.
Thank you so much for that answer. Aaron had a question as well. Aaron, are you there? Did you want to pop on and ask your question? I think this is the last question we can take. Not sure if she's there. Okay, I'll just answer it for her. She said, I struggle with being overweight and live in BC. Does your clinic offer weight loss solutions?
Yes.
As I am the person that does eat well and lives an active outdoor lifestyle.
Well, it's good to meet you, Erin, my fellow British Columbian.
I am here. It took me a minute to get organized. I have my computer set up to the TV, and then I'm kind of watching on the couch, so my camera's not definitely there. So yeah, that was my question. Hi, Liz. I know it's like the typical thing someone says, like, oh, I do eat well, and I live in Nelson, British Columbia.
Lucky you.
I know, I live outdoors. We are on the ski hill in the winter. I spent yesterday doing firewood. I'm outside a lot. Like, people say to me, like it shouldn't be like this. Like, my husband teases me. He's like you eat better than anyone I know, and you provide all these healthy meals for her. And I am struggling with being overweight. So, I'm interested in, because I've been struggling with that for quite some time, and my activity and lifestyle doesn't match my physique.
Right.
So, yeah.
It's nice to meet you, Aaron, from Nelson. My family and I just camped outside of Nelson for 10 days this past summer. I love it.
Yeah, beautiful.
Yeah, it is. So yeah, we do offer weight loss services at my clinic. Yes. And, I think what it would take in a case like yours, you describe a perfect scenario where you eat well, you're active, and yet you have what you would consider to be a specific physique. Mm-hmm. And is weight loss possible? I think it always is. I think you need to talk to somebody, an expert, who can look at, a diet diary, and look at your macronutrient intake. What is your carbohydrate intake? What percentage of it is complex and simple? What's your protein intake? What's your fat intake? What is the timing of your eating? How does your thyroid work? How are your adrenal glands functioning? What is your basal metabolic rate? What is your fat to muscle content in your body? There are a lot of variables or parameters that can be looked at to help a person address metabolism. Okay. It's not simple. But yeah, I think that there's, generally speaking, always a way.
Is it possible to work with your clinic if like an initial one where I could travel down to the Lower Mainland and then work with you, also remotely as well? Absolutely. Yeah. Okay. As some of the people on the call know now, that's how we roll. That's how we make it work. Okay, cool. Yeah. Right. Thank you so much.
That's great. What a great connection. That'd be awesome, Aaron. Going to get to the last question here. Molly O'Brien. We're interested in hearing from you if you would like. Okay, I'm going to just jump in here. With MDs often being the first stop and data suggesting integrative care is a better option, how far are we in the West from having an ND as a recommended essential part of the team from the early stages of detection?
There are a lot of centers now around the globe that have, like Memorial Sloan Kettering and the Cancer Treatment Centers of America, and there's a number of centers, hospitals that have naturopathic oncologists as a part of the team. So when a person's first being triaged, they have a diagnosis, a new diagnosis, and these are the people that you should go consult with to determine what the plan's going to be. But that's few centers, few and far between. We have a long, long way to go. As it stands now, people need to do it on their own. They need to reach out and build a team, just like Megan talked about at the very beginning of our talk here. She built an incredible team around her. It was all done by her, and we're still in a situation where that's what people are having to do. My hope is that it's not too long before naturopathic oncologists are a part of every hospital environment or setting, or clinics where it's purely an oncology clinic, and everybody diagnosed has a naturopathic oncologist, a medical oncologist, and then whatever other providers are needed for their specific case. But we've got a long way to go.
Thank you.
Well, thank you.
Just a quick.
Go for it.
Oh, I just wanted to say, is there this particular journey has been a little tricky for me, but I'm wondering if there's anything as a patient or an advocate for this kind of care. Like, is there anything that we can do to spread the word or that is helpful in North America?
It's a really good question. I feel like I need to get back to you on that, Molly. What I think I should do is put together a list of organizations that already are engaged in doing exactly what you're talking about, And I don't have them all off the top of my head, of course, but there are a number of organizations out there that are currently doing this, that are raising funds, that are out there pounding the pavement. They're doing good work. And I'll provide a list to all the listeners of who they are, so we can all engage and make it happen.
Thank you.
You're welcome.
Thank you so much, Molly, and everybody, for your really thought-provoking and important questions. I'm so happy to have you here live, Dr. Parmar. And like he said, he's going to share some more thoughts. We saw a few more questions come in on the chat. We will get those to Dr. Parmar, and we'll make sure that everybody gets their questions answered this week in a spare moment of your time, Dr. Parmar, and we'll get those back over to you. Frankie will be private messaging those who just won the raffle for Dr. Parmar's textbook of naturopathic oncology. And yeah, we're just going to keep rolling. We have two amazing doctors coming up, and we're going to go to a little 5-minute break. It's called the nature break. You guys can get natural in whatever way, water and whatnot, and we'll be back in 5 minutes. Thank you, Dr. Parmar. You're amazing, and we appreciate you.
Okay, bye for now.
See you in 5 minutes, everyone.
All right.